Welcome, and thank you so much for joining us. My guest today is Mandy Cotter, an account manager at GEHA. Mandy, thank you so much for being here.
Oh, thank you so much for having me, Drew.
So we know that open season is upon us, and there are so many options out there for federal employees who are in the FEHB program. For those who may not know, tell us a little bit more about GEHA.
No, of course, Drew. As a non-for-profit association, we at GEHA, which stands for Government Employees Health Association, put our members and the communities they live in first. And it all started in 1937, just after the Great Depression. A group of railway postal clerks in Kansas City would pass around the hat to help each other in times of need. And as GEHA has grown to serve more than 2 million members nationwide, we have stayed true to our values. And our mission at GEHA is to keep our members healthy and well. And today we're one of the largest medical and dental providers in the country that exclusively serves federal and postal employees, annuitants, military retirees, and their families. And GEHA is committed to creating a positive change around health and wellness. And with the focus on health equity, military and veteran and family support, GEHA employees are able to support local and national nonprofits, creating a tangible change in the community in which we live and serve. And most recently, we've worked with Veterans Community Project, Big Brothers Big Sisters, Folds of Honor, the Joe Delaney Swim Program, and many more.
Yeah, so it sounds like you guys have been around for a long time and you've done a lot to support federal employees in the program. But, of course, as I said, there's a lot of different options. So can you go through maybe some of the different plan options that GEHA offers within the FEHB program, and what should federal employees be looking out for?
No, yeah, great question. So GEHA has a plan that fits your needs, and we know one size doesn't fit all. So that's why we offer 5 unique medical plans really designed to meet you where you are in your life. And GEHA plans provide you a great value at any stage of life. We have a plan that fits your priorities, whether it's a low deductible, rewards for healthy living, Medicare coordination, or extended prescription coverage.
And maybe tell me a little bit more about some of those plans. Like, I understand that one that GEHA offers is its high deductible health plan. And I know that's a pretty common one, or a pretty popular one for federal employees. So tell me more maybe about this type of plan. What are some of the benefits that a high deductible health plan can offer?
Now, great question. And GEHA's high deductible health plan is a popular choice among federal employees. And this economical plan is for savvy savers whose focus is on future medical needs. And GEHA's high deductible health plan provides you greater control of your healthcare dollars through a robust HSA, which is managed by HSA Bank. Andrew, in 2022, GEHA contributed nearly $48 million to members' HSA accounts. And the money members can save in their HSAs can help pay for yearly deductibles and qualified medical expenses. And some of the additional perks of an HSA include that your HSA is tax-free savings account that you can use to help pay for medical expenses. And interest gained on your HSA account is 100% tax-free. And also, GEHA contributes money to your HSA, and you can add your own money to your HSA, kind of like what you do for your 401k, and you can watch your savings grow over time. And also, your balance grows over year after year. You never lose it. And also, GEHA's high deductible health plan has grown 250% in the last 5 years. It's our fastest growing medical plan across our offerings.
Wow, that is a huge jump. Is there, any reason you think that might have contributed to that? I mean, who are some of the types of federal employees or enrollees in the program who might be better fit or better suited for a high deductible health plan?
Yeah, many federal employees in the beginning are unsure about a high deductible health plans, but there are really a lot of benefits to the plan. And once they learn about how a high deductible health plan works and the values of having an HSA, they really truly realize the overall value of the plan. Now, some employees are worried that a high deductible health plan have unreasonably high deductibles, but actually all high deductible health plans in the FEHB contribute a portion of the federal employees' premiums to their HSA, giving them a lower net deductible. And some employees may think that they have to meet the deductible for preventative services, when in fact, preventative services are not subject to the deductible. And also, GEHA's high deductible health plan includes some dental and vision coverage that's not subject to the deductible. And another myth about a high deductible plan is that people think not all benefits are covered, but they will typically find the same kind of benefits are covered in a high deductible health plan than most any other plans. And they can learn more about GEHA's high deductible health plan by visiting GEHA.com/HDHP.
And Mandy, there's a lot of different plan options here from GEHA, and you went over a couple of them. What are some of the new benefits or coverages that GEHA will be offering for 2024?
Yeah, Drew. So this open season, GEHA is excited to offer new plan options for our retirees. And starting in 2024, GEHA is offering Medicare Advantage plans through United Healthcare, a United Healthcare GEHA Group Medicare Advantage PPO plan. We're committed to bringing choice and value to our members through our health plan offerings. And it's an honor to serve our retirees. That's why these exclusive plans are designed to help give them more, including Medicare Part B premium subsidy, $0 copays on covered medical services, national provider network, prescription drug coverage, dental care allowance, hearing aid coverage, and more. And some of the additional benefits include Part D prescription drug coverage through Optum Rx Pharmacy, provides retiree-focused benefits, services, and programs in one plan, no need to coordinate with primary and secondary payers, and comes at no additional cost. And it could be selected at any time throughout the year. Members must continue paying their GEHA high plan or standard plan premiums. And to qualify, you must be a GEHA standard or high member. So you would first need to enroll in a GEHA standard or high medical plans with Medicare Parts A and B as primary. And to learn more about GEHA's Medicare Advantage plans by visiting GEHA.com/Medicare Advantage.
And, thanks for kind of going through some of the different options, Mandy, that are going to become available for FEHB enrollees, or at least those who Medicare applies to. But, more generally, GEHA is one of many, providers that is available through the FEHB program. So I'm curious, from your perspective, what's the most important thing for an FEHB enrollee to do this open season? I mean, there's so many different options out there. There's so many questions you might be asking yourself. So what's the big takeaway here for FEHB enrollees?
Now, that's a great question. The big takeaway for FEHB enrollees is, reach out to GEHA as a resource this open season. We know as open season approaches, federal employees and retirees will have a lot of questions, and choosing the right health plan is a big decision. Our team of FEHB benefit experts is here to support you in that decision. They can help you determine which GEHA plan is right for you, answer questions like, is your doctor in network? How much would my prescriptions cost? And what's the most important to you when choosing a health plan? You can connect with the GEHA FEHB benefit experts by calling, texting us, or chatting, or scheduling a one-on-one virtual appointment. Whatever works best for you, we are here. And you can also visit GEHA.com/get in touch to meet with one of our experts in real time, Monday through Friday, 7 a.m. to 7 p.m. Central Time.
Great. Well, Mandy, thank you so much for joining me today.
Thank you so much, Drew. It was my pleasure.
Mandy Cotter is an account manager at GEHA, and I'm your moderator, Drew Friedman. You're watching Federal News Network. Now let me send you back to the studio for more on the Open Season Exchange.